Okay, thank you. So here I am again. I'm proud to present the next research about the effect of 12 months physical therapy according to BSPTS Schroth-based program on quality of life and self-perception of trunk appearance in reference to puberal maturity. We have nothing to disclose. The objective of this study was the outcomes of non-operative scoliosis treatment using physical therapy scoliosis-specific exercises according to BSPTS Schroth-based 12 months program on quality of life, back pain and perception of trunk appearance. We formed a group by 64 girls diagnosed with adolescent idiopathic scoliosis. 60 girls were divided in two groups by status of pre and post-menarche. There was no statistical difference between cup angles in both groups. Cup angles were measured on base of X-ray during the first examination. The characteristics of the groups were onset of scoliosis, menarche, body weight and body age. We used in- and exclusion criteria to form the study group. Most important was the diagnosis with adolescent idiopathic scoliosis. They also should have followed a rehabilitation course of at least 2 weeks group therapy with exclusive scoliosis-specific exercises according to BSPTS therapy program. After this course, they were delivered with a home program. From the study group were excluded the women who were treated with brace, surgery or with other than BSPTS methods. Also, we did not take 2 weeks of group therapy and not respect recommendation. The value of the cup angle is measured by X-ray. The value of the virtual scoliosis angle is determined by using phometric, quality of life, back pain and self-perception of trunk asymmetry were evaluated using the questionnaires SOSORT 22, the FAST scale and the TAPS. The subjects were assessed 2 times at the beginning of treatment and after 1 year. Most important result is the decreasing value of the FAST scale. 0 is the measurement at the start and 1 after 1 year. You also see that the maximum score of the FAST in Group A at the beginning is much higher than Group B. This graph shows you the results of the TAPS scale. 0 means again at the beginning and 1 is after 1 year. Both groups showed a significant difference in measurements 0 and 1. At the beginning we see quite a low level of self-perception of trunk deformation in both groups. After 1 year it's much better. This table presents the results of the SOSORT 22 in every domain. Group A showed a quite high level of self-image and function at the beginning compared to Group B. In total score, you see Group B obtained a better improvement of quality of life after 1 year and also statistical significance. As you can see, the level of quality of life was high from the beginning in both groups. The results of the phometric parameters, the results in Group B are statistically significant and the average of the virtual scoliosis angle decreased from 40.35 and 33.6 degrees. The results in other subjects, the pain decreased significantly in both groups. Self-perception of trunk deformation improved significantly in both groups. In SOSORT 22 we did not obtain statistically significant difference in Group A, but we did in Group B. In Group A the level of quality of life was quite high from the beginning, and the value of the virtual angle decreased significantly only in Group B. I would like to summarize our research. Results of Schroth BSPTS therapy are improvement of quality of life, pain and self-perception, and females diagnosed with adolescent idiopathic scoliosis after menarche have shown better results in reducing the virtual angular value of the curve and improving quality of life than those diagnosed before menarche. Thank you very much.